Have you ever wondered how health experts really know if we're healthy? I mean, how do they actually read the story that our own body is trying to tell us? Well, today we're going to dive deep into the science of nutritional assessment and unlock that exact story. Let's start the investigation.
Okay, so take a look at these three babies. Just at a glance, you can probably see three very different states of health, right? But how do we get past just looking? How can we scientifically, objectively tell the difference between someone who is optimally nourished, undernourished, or even overnourished? That's the big mystery we're going to solve today.
So it all starts with this one core concept, nutritional status. The best way to think about it is like a balancing scale. On one side, you've got all the nutrients you're taking in. That's your intake. And on the other side, you've got what your body actually needs to function, your requirement. When that scale is perfectly balanced, you're in an optimal state. Simple as that. But when it tips too far one way or the other, that's where the problems can start.
So how do we figure out if that scale is balanced? Well, that's where nutritional assessment comes into play. You can think of this as the official investigation. It's the real detective work. It's the whole process of gathering and interpreting all the different data points to build a complete, accurate picture of someone's nutritional health.
Every good detective needs a toolkit, right? And it's no different in the world of nutrition. So now we're going to open up that toolkit and look at the main methods, the tools and techniques that health pros use to gather all the crucial clues that make up your health story. Now, this investigation can happen on two totally different scales. First, you've got direct methods. This is when the detective is focused on just one person, you. They're measuring objective things, stuff they can get directly from your body. But then you've got indirect methods, where they zoom way out and they look at community-wide data to get a feel for the health of an entire population. For now, though, let's focus on those direct, individual clues.
All right, our very first piece of evidence comes from something pretty simple: physical measurements. The fancy name for this method is anthropometry, and it's all about, well, quantifying the human body.
And the name itself pretty much tells you everything you need to know. Anthropos means human, and metron means measurement, so it's literally human measurement. This covers the basic stuff you'd probably think of, like height, weight, and of course the body mass index, or BMI. This is really the first, most fundamental set of data in our entire investigation.
And you know, BMI is actually something you can figure out for yourself pretty easily. It's a really simple formula. You just take your weight in kilograms and you divide it by your height in meters, squared. This little number gives us a quick, standard way to get a snapshot of body composition.
So you've got this number. What on earth does it actually mean? Well, this chart here shows the standard breakdown. Generally, a BMI somewhere between 18.5 and 24.9 is considered in the normal range. As that number climbs, you move into the overweight, obese, and then extremely obese categories. Now, it's a super important piece of the puzzle for sure, but remember, it's just one piece.
Okay, our next clue? This is where the detective work gets really, really interesting. Because our bodies, they often give us these visible, physical signs about what's going on inside. We just have to know what we're looking for.
And this really speaks to the power of just simple observation. You know, a clinical exam is often the easiest and most practical method there is. It's all about looking at things like your hair, your nails, your skin, your eyes, looking for those telltale signs that we know are linked with specific nutrient deficiencies.
So let's look at some real-world examples. If someone's hair is sparse, thin, and super easy to pull out, that could point to a protein or a zinc deficiency. Nails that are kind of shaped like a spoon? That can be a classic sign of an iron deficiency. And those little horizontal lines across your nails might mean a lack of protein. See? These are all clues hiding in plain sight.
And the clues just keep coming when we look at our eyes and skin. For example, having a hard time seeing at night could be a big red flag for vitamin A deficiency. If you find yourself bruising super easily, that could be related to a lack of vitamin K or C. Even just having pale skin, or pallor, can point our detective towards a deficiency in iron, folic acid, or B12.
So after looking at all the physical evidence, what does our detective need next? A witness statement. And that brings us to clue number 3, the dietary assessment. This is all about finding out what a person has actually been eating. You do this with things like a 24-hour recall, a food frequency questionnaire, or even a detailed food diary. And finally, to really nail it down and confirm all the suspicions, we turn to clue number 4, the lab report. This is the hard science. Biochemical tests, think blood or urine samples that get analyzed for things like hemoglobin or specific nutrient levels. They provide the solid scientific proof that backs up all the other evidence we've collected.
Now, here comes maybe the most important part of this whole process. A good health detective never relies on just one single clue. No way. They put everything together, the measurements, the physical signs, the witness statement from the diet, and the lab report to solve the case and land on a final, accurate diagnosis.
And this slide right here is a perfect example of why that is so important. Just look at these two types of severe malnutrition. Someone with marasmus, which is a deficiency of both protein and calories, looks very thin. But someone with kwashiorkor, a protein-only deficiency, might actually look well-fed or even overweight because of fluid retention. You see, if you only looked at their weight, you would miss the real story completely.
Now, what's really powerful about all this is that this detailed detective work doesn't just work for individuals. These exact same principles can be scaled way up to understand the health of an entire community or even a whole country using those indirect methods we touched on earlier.
For this kind of big-picture work, public health detectives look at a different set of clues. They analyze things like a country's infant mortality rates. They look at economic factors like food prices and how available food is. And they even check out ecological data, like how well the crops are growing. It's all part of piecing together the nutritional status of a whole population.
So, after all this detective work, what's the big takeaway here? Well, it's that getting to optimal health isn't about some magic bullet. It's about understanding the complete picture. You know, the path to good health laid out here is the goal you're aiming for, but the real key is learning how to listen to the signals and clues that your own body is giving you along the way.
So we've unpacked the science of how health professionals really solve the mystery of our health, which leaves us with one final question for you. Now that you know how the investigation works, what clues is your body giving you? Thanks for tuning in.